Hey, weight loss warriors, I got a call from my surgeon's office regarding my revision surgery, and frankly, I don't know how I feel about it. We'll talk about it in a moment. Thanks for tuning in again to the Working Girl's Guide to Weight Loss Surgery. I'm just going to get right into the video here. Got a call on Friday from my surgeon's office, and she said that there was a scheduler, the surgical scheduler, and I don't exactly remember what she said as I look back on the conversation, but she called and said that there had been some things that were going on regarding the surgeon. I think she said something to that effect. My first reaction was that it was something personal that was probably going on with him, and she said that they need to change the date of my surgery. So the surgery was going to be rescheduled from August 20th now to August 26th. So I thought, okay, fine. Start thinking about my pre-op diet and when I'd have to do that. So then she started saying that they were also going to move the location of the surgery to a different hospital. All right, fine. Then she goes on to say that I would now have two surgeons performing my procedure, that there was going to be a doctor assisting my surgeon with the procedure. So I'm like, all right, fine. So she mentioned the name, and I, knew the name and knew that he was the medical director, that he is the medical director. And actually, I was familiar with him because he was the first doctor that I saw in the weight loss seminar over 6 years ago. And he's fine and all, but I decided not to go with him. At the time, I chose the other surgeon that performed my surgery in 2013. And even when I was looking to get treated for the GERD or see what my options were regarding the GERD, I didn't go with this doctor, the medical doctor, this year, and had selected another doctor. And actually, even after my surgeon left, I chose not to go to the medical director. So there were three opportunities really for me to select this doctor, and I just didn't vibe with him when I've encountered him in the past. So I just opted to go to somebody else. But now he would be helping with my case. Now, I was just kind of surprised by all the details that she shared with me. So kind of had to unpack all of that really mentally and think about what all of this meant. So now I've got this new date. I'd already submitted paperwork to be off from work, things like that. Was starting to get the food together to start my pre-op diet on August 6th. So now I'm thinking, all right, that's not going to happen. It actually, the change in date impacts who might be available to assist with my aftercare. So it's just a matter of 6 days, but it was going to have a big impact on me personally and how I would be able to respond to getting ready for the surgery. But as I just started thinking more and more about it, it's like, okay, so what is going on? Why am I going to have two surgeons involved with my surgery now? It seems a little unusual to me, and I'm trying not to speculate. I'm trying not to put too much into it, but I'm one of those people. I need to know more information. The young lady said that my surgeon would probably talk to me the day of the surgery to kind of explain to me what was going on, and sounds like why the change would occur, but that's a month away. I'm not real comfortable with the fact of whatever's going on, and it could be benign enough. It really could be something simple as something personally going on with him, scheduling changes, whatever. This other surgeon just might be assisting because something went on. I had heard something about possibly my surgeon having had a death in the family recently, a very close death in the family. I don't know if that's true or not. And I certainly could see if that's the case, then it would probably impact the schedule for quite some time before he could catch up. I don't know. I don't know what's going on, but I'm just, it's giving me some reason to pause to figure out what the heck is happening. So I'm going to see what I can do to find out a little more information now that I've had a chance to kind of think about it over a couple of days and kind of think about what exactly it means. already was hesitant because of the issues that happened with the Bravo PH study. Granted, this was a completely different provider, but this is recent experience where it didn't go all that great, and now we're having this come up. So I'm just trying to wrap my brain around it and what it could mean. Again, it could be very benign, but I just need to feel better about the entire experience. I mean, if I don't feel comfortable in whatever response, because I am going to follow up with the bariatric center to find out more about what's going on and see what kind of explanation they provide. Obviously, the scheduler was probably limited in what she could reveal, but I want to know, even if that means I'm reaching out to my surgeon to have a conversation directly with him prior to, because like I said, if I don't feel comfortable with this, I'm not going forward. I feel very strongly about you needing to be mentally and spiritually in the right place before you go under the knife for surgery. So I have to get myself together mentally and spiritually to be all right with moving forward. And frankly, I don't want to have to cancel the procedure. I still have the issues with the GERD. I'm still having to take the Prilosec. I still have this huge hernia that needs to be addressed. So moving forward I think would be the best thing to do. But if there's something else going on with my surgeon, that his boss needs to be involved with my surgery, I'm a little concerned about that. So I will keep you posted. I try to be as forthright with all of you so that you're right here on this journey with me, and any words of encouragement or any advice that you have to help me out, I really appreciate it. So I will talk to you guys soon, and have a good day.